Okay, so I'm going to take 7 minutes to explain to you my patient, what she presented with, and obviously you can see she presented with pneumonia. She was tested and she was positive for Streptococcus pneumoniae, which is pneumonia, and so she was treated for that. She came in with signs of fever and a cough, and she had a shortness of breath and pain in her chest. She was also very fatigued and she couldn't walk in. She was actually so fatigued that she had to come in a wheelchair. So she was dealing with the neuromuscular part of it as well. Okay, so I put the pathophysiology of the pneumonia so that I could explain it a little bit more. Her lungs were filled with fluids. Right away as she came in, she was given a blood culture test as well as CBC, and they found out that many of her, first of all, she was positive. She was found positive for the Streptococci pneumoniae, and she was also positive for the influenza B, influenza A, which, so she had flu and pneumonia, and so she was quite dehydrated, and so they gave her fluids. She also received an antibiotic, which is azithromycin. She received azithromycin. Can you still see the poster? Okay. And she received ceftriaxone because she was bedridden for quite a long time, and to keep her from getting DVT and getting a pulmonary embolism. She received insulin because she was a diabetic, and so she was actually quite faithful in taking her insulin. But if you're to look at her CBCs, you'll see that several parts of the CBC indicate that she might be headed for a metabolic acidosis, because first, her white blood cell count was high, so that's obviously revealed the infection, that she did have infection, and after this the blood culture, they were able to see what infection it was causing. Her red blood cell count was actually quite low, and so was her hematocrit and her hemoglobin. That tells me that her kidneys, that her cells, her red blood cells, are not getting enough oxygen. Her creatinine was low, or was high, and also her bun was quite high, and so that was a little bit scary. So that tells me that her kidneys are not functioning properly, and so that's something that we might keep an eye on. Also, her bicarbonate was quite low, and so she might be headed towards something pretty scary. Okay, so what I would do for her as part of the nursing plan is I would the very first diagnosis would be ineffective airway clearance. That's obvious. With the pneumonia, you have a lot of exudate in there, and your lungs are very thick, and you can aspirate, but also you can't get that airway cleared. And so what I would do for her, I would sit her up. I would make sure that she was in a comfortable position. I would suction her if needed. I would make sure she had plenty of fluids. I would do oral hygiene on her mouth, because she needs to have that. That oral hygiene will help to dry up secretions, get rid of those. And clean up the dried up secretions in there. I would consult her husband. The reason I would do that is because she could not speak any English, and so there was a difficulty in talking with her. I don't know how many minutes is that, Danielle? Okay, 4. Okay, so I have 3 more minutes. Okay, and so I would do all of those things to make it a more effective airway clearance. She had met that by the time that I came in to the hospital. She was pretty tired when I first got there, and so she needed the majority of our help to get to the bathroom by the time I got there early in the morning. But by the afternoon, she was trying to do most of the work herself. She still called us to come in and help her go to the bathroom, but she was able to move from the bed to her chair by herself. But we didn't want her to. We wanted to be in there to keep her safe. She was her cough was quite productive even from the beginning, but her cough became more productive. She was able to clear more of that exudate that was in there, and that was a good sign that she was able to clear that. When I assessed her lungs, there was some diminished breath sounds, which is common for pneumonia because you have those fluids in there, and you cannot hear those breath sounds. My second diagnosis would be the impaired gas exchange, and that's because the alveoli are filled with that exudate, and they are there's no room for that gas exchange. And that was obviously obvious too with her CBCs, that her blood was not getting that oxygen that was needed, and she was retaining that CO2, but also the CO2 was not getting where it needed to be. So she was having some issues with her blood not getting the oxygen that was needed. Her red blood cell counts were very, very low. She was so as far as nursing diagnosis for that, and as far as my implementations to help her for the gas exchange, I would make sure that she got rest because she needs that for the gas exchange. I would make sure I would actually give her oxygen, but a very low oxygen. How much? And in conclusion, that's what my daughter told me to say. The very third diagnosis I would give would be, sorry, I have to read it. Inability to speak and understand the English language. And so it would be impaired verbal communication. So what I would do is we got an interpreter, and we also spoke with her husband, and we made sure that she understood what we said before we left the room. We wanted to make sure we communicated with her non-verbally and verbally. It's okay, I can go a little bit over. Anyway, those are the three nursing diagnoses that I had. I didn't have time to go over all of the interventions, but I have 10 with each one, and they're like this. So if you look at my poster, you can see that I have 10 interventions with each nursing diagnosis underneath here, and then I did the concept map. So there you go. Thanks.